I'm Dennis Anderson along with Julie Zenner, and here's what's coming up on Almanac North.
If you purchase health insurance on the open market, changes continue to create a confusing landscape. We'll get an update from a Minnesota lawmaker who serves on the Health Reform Committee.
125 years ago, Duluth's most enduring tourist attraction was born. A celebration is planned later this month, but first, volunteers are needed to spruce up Skyline Boulevard.
And we'll feature a news file story from 25 years ago and bring you the week's top business headlines.
So stay tuned. Almanac North is next. Hello and welcome to Almanac North. Thank you very much for watching. This week's show was recorded on Thursday due to the 4th of July holiday weekend. And now here's Julie to introduce our first guest.
All right, thank you, Denny, and welcome everyone. For Minnesotans who do not receive health insurance through their workplace, the MNsure State Health Exchange provides one-stop shopping for insurance plans. But MNsure has seen a number of providers change plan options or even pull out of the market completely in recent months. And that has left a number of questions about the future of the health exchange. Joining us now with an update is State Representative Jennifer Schultz, a Democrat from Duluth. And thanks for being here. Really appreciate it.
Thanks for inviting me.
Blue Cross now says it's going to reduce its plan options on the exchange. Was that a surprise to you at all?
Well, last year they increased premiums by about 49%. So they were losing money on with individual plans. And these are plans that people, if they don't have access to health insurance through their employer, have to go out and shop for themselves or their family members. And about 6% of the population in Minnesota goes out and purchases a plan on their own. So they had increased premiums. They lost about half of the market. So they were selling 43% of the individual plans out there. And now this year they were selling 21% because of that increase in premiums. So it's not a total surprise that they're pulling out, because they did lose $265 million this year, where that means that their costs, medical costs, were more than the premiums they were collecting for these types of plans. But in light of that, they do have over $10 billion in revenue coming in.
This is a huge issue, though, Jennifer, in the state of Minnesota. Younger people apparently are not buying insurance, they're not paying premiums.
Well, when this was formulated, this exchange, they thought, because it's mandated through the Affordable Care Act, that younger people would be buying insurance. And the average age for these plans is between 44 and 45 years old. So that's one of the problems, is we don't have the young people subsidizing older individuals who might be sicker than the young.
Are some of them still living at home, where they might be under mom and dad's insurance too,
well,
so they're not buying?
They can be up to age 26, they can stay on their parents' policy. That's one thing. And the other thing is that they're just not affordable for many families and young people. And so they forgo it, and it's cheaper for them to pay the penalty or the fine during tax season than to buy the policy with the higher premium. And the other problem is we saw a lot of families and individuals selecting a plan that basically had very high deductibles and much lower premiums, but left them underinsured, meaning that they couldn't afford care because the deductible was so high.
They couldn't win either way.
Right.
Mm-hmm. Do you see this as a sign of continuing turmoil in the insurance industry? How do you see it shaking out?
This is a very unstable market right now, and so Blue Cross Blue Shield made the decision to pull out because the risk was too great for them financially as a business. And we'd had other plans pull out. Preferred One was the last plan in 2014. And so this is a bad omen for going forward. And we have to remember that when we were putting together the Affordable Care Act at the federal level, that this was a compromise, this type of exchange. Initially, a public option was included as part of an exchange, and that was taken off the table as a compromise to get support for the final bill that became the Affordable Care Act. And I think we need to go back and put a public option on the table. So we introduced 2 bills this last session. One was to make the CGIP, State Employees Health Insurance Plan, open to anybody and make that a public option on the exchange. The other one was to make Minnesota Care a public option and let others enroll. And so those 2 bills got a hearing. The Minnesota Care one got a hearing in the Senate, but nothing got a hearing in the House. So really, we'll see what happens in the next session.
Do you see the possibility, Jennifer, that other insurers may be pulling out?
It's always a possibility. If Blue Cross Blue Shield, they did have a little bit higher average age of those that were in their plans compared to the other carriers. And so those individuals, if they sign up with the other carriers, they're going to see more costs and more risk. So they could pull out. We'll know more by August 1st. That's when the first round of premiums are due to the state. And then by October 1st, those premiums will be finalized.
So what's the actual impact when a provider like Blue Cross Blue Shield pulls out? What's the impact on the people who are within the exchange rate?
So the total number of people impacted is 103,000. 20 of those individuals are on the exchange. The rest, 83,000, are off the exchange in the open market. So it's really not a MNsure problem, and it's really a problem with this 6% of people who don't get coverage through their employer.
But it's still a problem for MNsure.
It's still, so these individuals will go out if they qualify for a tax credit because they're lower income, they have to stay on the exchange, MNsure, and shop for a different carrier. And so there's other options out there. And they could also shop on the open market if they don't want to receive the tax credits or don't qualify for the tax credits.
Are there some advantages for the people who are currently shopping on the open market to maybe go into the exchange and start to look at the options there as far as better rates, better opportunities for them, greater assistance?
You know, they
like
actually, people may not realize this, but many people may qualify for a tax credit. So the income limit's pretty high based on your family size. And I think it would behoove them to go on the market and shop and look at all the different options on the exchange.
What do you see for the long-term future of what was called the Affordable Care Act, but it turns out to not be as affordable as people hoped it was going to be? What do you see happening there?
Well, I think we need reform at the federal level, and I think what's happening at the federal level is they're allowing states to experiment with innovations. And so we put together several bills to request that the state agencies ask for federal waivers to innovate on our exchange and with our public programs to make them more efficient. And one thing that has to happen is we have to change how we pay for services. So right now, healthcare costs are going up. That leads to higher premiums. That leads to unaffordability. So what we have to do is change how we pay. We need to pay for providers to improve population health, improve the health, and not just provide lots of services that may be wasted and not useful and not extend life or improve quality of life at all. So we need to change that whole model, and that's just taking time because right now, providers are really trying to figure out what their actual costs are. And we want them to start minimizing their costs and focusing on improving population health.
That's got to be harder to prove, though. You know, it's very easy to put a number to actual services that are provided versus diseases that were averted. How do you start to measure that?
It is hard, but it's all about incentives. You know, I'm an economist, so it's really you have to structure the incentive. So right now there's no incentive for them to limit prescribing any type of procedure or medication because they get reimbursed for that. If the incentive was you're going to get paid to improve population health, maybe they're doing their mammographies, they're doing preventive health, they're giving the flu shots, and that's actually going to save money. Maybe they're working on, you know, and public health, investing in public health so people change their health behavior. So they're eating healthy, they're exercising, and put more emphasis on preventive care and changing behaviors, which is hard to do, but we need to do that if we want to reduce healthcare costs.
Baby boomers, many of whom have health issues, are going to be retiring in huge numbers over the next several years. What's that going to do to the healthcare industry?
Well, that's going to put Medicare in a difficult position because elderly senior citizens are eligible for Medicare, and it may bankrupt that system if we don't do things right now to change how we prescribe and how we utilize our health care for those aging. Right now we spend a lot of money at the end of life, and we spend money that doesn't really improve or extend life or improve quality of life. So right now the research community is analyzing what improves health and what improves quality of life and what doesn't, and so providing guidelines based on evidence coming from providers to help them adequately care for their patients without harming their patient, also with the mindset that they need to try to be mindful of how much things cost to the system.
And retirees will be paying more and more for health insurance premiums. Basically, for most of us, it's 20% of our coverage because the federal government provides 80%. It's a lot of money.
It is a lot of money. Hillary Clinton's proposal is to open up Medicare to those as young as 55 years of age, and to help stabilize the Medicare market when we do have this aging demographic. So that's one idea that needs to be vetted more. But I think the whole problem is that we segment this market. And you've probably heard of people say, well, we should just have Medicare for all. That makes sense from an economic perspective, because putting everybody in one pool can be much more efficient and save money, and then you're focusing on population health, and you can have, it's easier to subsidize and manage, and you really don't need to manage risk as much, you need to manage costs.
Mm-hmm. Would there still be premiums in that sort of a system, or would the government pay for everything?
Well, right now, you can finance two ways. You can have premiums finance healthcare spending, or you could have taxes finance it. So if we have everybody in one pool, one option, well, we won't subsidize it with premiums, we'll have a tax and make it progressive in the sense that we're not taxing too heavily low-income people. So it could be very similar to what we have now. We would have providers, free market on the provider side. People can select any provider they wish, but the insurance part is one big pool where we're spreading risk across a large body of individuals, and we have that cross-subsidy going on.
The whole insurance issue can be very confusing for a lot of people. People on MNsure, are they safe with their insurance?
Are they safe with their insurance? Yes. I think 20,000 individuals we're going to have to find a new plan, new carrier. And that doesn't mean that they're going to have to find new providers, because many of those providers can be in multiple networks. But they do have to find a new insurance carrier, and that will happen this fall. So they're fine until the end of December, when they have to go out and shop for a new provider, new plan.
Mm-hmm. On a statewide level, any health insurance policy ideas that both parties are agreeing on at this point, or are things really still pretty
unfortunately,
divided?
Even some things that I thought would have been bipartisan, like an evaluation of telemedicine that we passed last session, we couldn't get that through. I was on a bipartisan healthcare finance task force that the governor put together, and we had 33 wonderful recommendations, and none of those got heard in committee. We wrote bills for the recommendations, so there wasn't a lot of bipartisan support around reforming healthcare. But at least we had a great task force that met for over 5 months, and we had really good discussion and learning going on about what needs to happen and change.
Yeah.
And that report's available online. People can read it if they're interested. So hopefully next session we can do a lot more.
Very quickly, special session, is it going to happen at all?
You know, I would say it used to be 50%. I would put it at like 30% special session. We need one. I hope we get one. We need a bonding bill.
All right,
This was a
Representative
great
Schultz,
discussion.
thank you so much for coming in. Appreciate it.
Thank you.
Thank you.
Now, let's dig into our news file archive for a look at what was making news 25 years ago this week.
This fountain is one of the devices legally sold in Wisconsin. Those who sell such fireworks maintain they are safe and something the entire family can enjoy for the holiday.
I guess it's one of your senses, the sense of hearing, the sense of excitement of the color, the explosions that you hear. Of course, everybody's awed by a loud noise.
Larry Hughes is a former member of the U.S. Navy. He says patriotism has a lot to do with people buying fireworks from him. Many families come to buy fountains, sparklers, and other fireworks, and parents here agree with the salespeople that you must follow directions and that kids shouldn't use these alone.
Not necessarily kids. You know, they should be supervised. We don't just let them run off and light the neighborhood up, you know. They're supervised.
It is big business here in Superior, especially just across the bridge from Minnesota, where a majority of customers come from to make their purchases.
Joe Thornton, KDLH News.
Duluth Skyline Parkway is the city's crown jewel. Roughly tracing the shoreline of an ancient lake, the drive was the idea of the city's first park board president. Today, Skyline stretches 25 miles from Beck's Road to Brighton Beach. Now, later this month, the city will celebrate the drive's 125th anniversary. But before we talk about the future, let's look back at the birth of Skyline in an excerpt from the WDSC documentary On the Boulevard.
It's astonishing that it started when it did. Duluth, started as a lake port, hit hard times in the 1870s for a while, had overextended its municipal debt, lost its charter as a city, was incorporated as a district and a judicial district under governance by judges, and only 2 years after it was back on its feet as a city, then you've got this guy from Ohio, William K. Rogers, saying, let's do something really great. This is going to be a great city. Let's do something here that takes advantage of a natural setting that's unequaled in the country.
When J. Cook came to town and he decided to bring the railroads through Duluth, this was seen as the center of the North American continent, and where at this location at the head of the lakes is where a major metropolitan community would grow. And really at that time, at the turn of the 19th to the 20th century, we were going to rival Chicago. With the railroads coming in and the ships and the transportation system that was in place, we were going to rival that. And so we needed to have a parkway system that was worthy of that great of a city.
And joining us with more on Skyline's history and the upcoming celebration is Doug Stevens with the Duluth Preservation Alliance and the event planner, and Cheryl Skafte is the City of Duluth's volunteer coordinator. Thank both of you for being here. Doug, maybe you could tell us first off the bat, why is Skyline Drive so important to the development of this city?
Well, it's the place that really offered you the greatest views. If you remember when Duluth just started, all the industries were down below and near the water, and they needed to be, so it was an ugly area of town. So you wanted to get away from that and get up on the boulevard, and that's where the views were for the lake.
Mm-hmm. As you look at Skyline Parkway, what are the most significant stops along the way from a historic standpoint?
One of the most significant places, I guess, has been Hawk Ridge recently, because that is so popular for birding. Seven Bridges Road is another very popular spot. The railroad overlook, or the Ordock overlook, is a very popular spot to be, and of course a lot of the parks that are there are very popular too.
The Ordock overlook, is that the one near Skyline Drive?
It's just up above Wheeler Field.
Okay, yes,
Yeah.
That's a beauty.
Yeah, it's
You can see
beautiful.
forever from up there.
Yes.
Yeah, exactly. So what's being done by the Preservation Alliance and the city to improve Skyline Parkway?
Do you want to help?
Well, one thing that we're doing to help kick off the 125th celebration is inviting folks in our community to step up and help us clean Skyline Parkway. So Skyline Parkway is and has attracted a lot of illegal dumping and abuse, and we want to raise awareness about the history of the Parkway, but also invite people to help us care for the Parkway and to thank the Parkway. So we are offering an opportunity on Saturday, July 16th for people to help us clean it up.
Mm-hmm. Are there groups that have already started to sign up for this, or
yeah,
individuals?
we have had a couple groups that have signed up, including Woodland Hills and a few other teams in town. So we're really excited and hoping that we fill all the slots. We have about 17 sections to fill. So we're going to do the entire length of Skyline Parkway, which of course extends from Beck's Road all the way to Seven Bridges Road. So it's a big challenge that we're hoping the community will help us meet.
Can people who sign up, can they choose the section of
They
Skyline
can.
based on their own personal connections or areas where they're close to?
Yes, that's what we hope people will do, is pick the section that they are either connected to because it's a section they like to walk, or it's a section that they live next to, or maybe there's a significance to them of that section. So each section is about a mile long, and folks will clean it from about 9 to 10:30 on that Saturday morning.
Doug, some of the views along Skyline Parkway over the years, maybe over 30 years, had been obliterated by the growth of trees. Are those trees coming down? Are we doing something to once again improve the view?
Yes, that is going to be happening as we're speaking this year. And thanks to Charlotte Gartner for bringing it up to the City Council. She wanted the vegetation plan of the corridor management plan adopted, and the City Council approved it. And so now it is allowing Skyline to become actually a park. And there are plans to do tree thinnings along the parkway. And of course, it's going to take a lot of years to do that because the parkway is 25 miles long.
Sure.
And it's going to take more than just a year to get the thinnings done.
I'm also thinking about 25, 30 years ago, a green line was painted along Skyline Parkway to allow tourists and locals to know that they're still on Skyline Parkway. Something like that also in the offing, do you think, in the future, where we might do that again?
We talked about that some years ago. And
didn't help?
Well, everyone thought it was too confusing because when it got foggy, they thought the green line was not the line, the center line, but was a line along the road, and it made it confusing for traffic.
Okay.
Mm-hmm. So you're asking people to come out and help beautify Skyline. People in the community feel a real connection to that stretch. Why do you think that is? So what makes you think that people are going to get up on a summer Saturday and go out and clean Skyline?
Well, that's a good question. I think we're really hoping that people will want to give back to a park that has given a lot to us, the history of it, and I think you're right. One thing that I've really noted about my time in Duluth is that people are really proud to be Duluth, and more we're being recognized for our outdoor spaces. And I think one of the hidden things about those outdoor spaces is while we celebrate them, it also takes a lot of work to keep them clean, because we do see a lot of people that aren't treating those parkways or those parks with the respect that we want to see. And so it really is a community effort to keep those clean. The Ordock Overlook is one of people's favorites, but just a month ago we were up there pulling 9 tires that somebody had thrown over the side of the wall. And I think Doug can speak to this. He's organized many teams that have gone out and cleaned, and he'll come back with reports of appliances that have been thrown on Skyline, household garbage that people dump on Skyline. And it really is the responsibility of the whole community to be keeping our eye on that and to be utilizing the Skyline, because that's one way that we can keep it safe.
There were plaques at some of the overlooks describing what we were looking at. Some got damaged, vandalized. Are there still plaques, and are they being repaired if there are?
Yes, they are. As a matter of fact, Bob Hull from the Duluth Lions Club is very interested in restoring all the plaques that were put on by the Lions Club back in 1972. And they do want to restore the plaques, they want to update them, and they want to clean the areas around the plaques, and possibly even put up a bench to sit at so you can enjoy the views.
I understand we have some historic pictures too of things like coach parties that went along.
Tally ho.
Yeah,
Yes.
talk about that a little bit as these pictures come up from a historic standpoint.
The tally ho parties were very popular, of course, because it opened for horse and carriage. And men and women would get dressed in their finest, and they would board these elaborate carriages, and the horses were 4 to 6. And the reason why they got called tally-ho parties is kids used to love to watch these people go by, and they would yell tally-ho at them. And then the people on the carriage would yell tally-ho back and throw pennies at the kids.
Are there going to be any tally-ho parties this summer for the celebration?
Unfortunately not.
Any tourists who may be watching, Skyline Drive is the place to check out, right? Skyline Parkway is a gem. All right, thank you very much. Doug, Cheryl, appreciate you being here. Thank you.
It's time now for the week's business headlines from our friends at Business North. St. Luke's hosted a groundbreaking ceremony Tuesday as it prepares to construct its new Hermantown Medical Clinic. The new clinic will be located on Lohberg Avenue across from Home Furniture. The clinic will provide urgent care as well as primary care, along with ophthalmology, orthopedics, obstetrics, and rehabilitation. The new 20,000 square foot building will be about 6,000 square feet larger than the clinic it is replacing on Highway 53.
Superior Water, Light and Power Company has filed an application to increase rates to cover the costs of replacing aging infrastructure. The request was made with the Public Service Commission of Wisconsin. Superior Water, Light and Power requested an overall rate increase of about $2.7 million. Under the filing, electric rates would increase 3.46%, water rates would go up 7.83%, and natural gas would rise just over 1%. The actual amount of any rate change will be determined by the Public Service Commission after review and public hearings.
On Monday, the Grand Rapids City Council accepted IRRB grant funding for a manufacturing plant in the city. Swan Machine plans to construct a permanent facility that would support 10 new positions. The company currently leases space for its Grand Rapids operation, which employs 5. Swan Machine is a manufacturer of precision machined components and employs 140 people at its primary location in Perham, Minnesota. The $166,000 IRRB grant will be used to prepare a site located in the Airport South Industrial Park. For more on these and other stories, visit businessnorth.com.
If you have a comment about our show, now's the time to call. Dial 218-788-2849 to leave a message or send an email to almanacnorth@wdsc.org and visit the WDSC website for the latest information about the station, updates on your favorite programs, and news about station events. And Julie, one of the biggest weekends of the summer when we celebrate our nation's independence with all sorts of parades and fireworks.
Yeah, lots of people looking forward to Fourth Fest here in Duluth and other activities around the community, around the region.
Sure, should be a lot of fun. For Julie and the crew at Almanac North, I'm Dennis Anderson. Enjoy your 4th of July. Good night, everybody, and be kind.